Hello, my name is Dr. Kimberly Cheatham. Welcome to this presentation on normal puberty. The objective of this presentation is to discuss the physiology of normal puberty and the normal menstrual cycle. Discussion of pubertal physiology begins during fetal life. Gonadal development begins approximately 5 weeks after conception. By about the 10th week of female fetal development, an ovary can be identified. By 20 weeks of gestation, peak numbers of primary oocytes or their precursors are present in the fetal ovary. At birth, oocytes number about 2 million. Subsequently, their number declines to about 400,000 at puberty, with continued loss until menopause around age 51 years. Here is a diagram of the hypothalamic-pituitary-Ovarian Axis. These structures are responsible for the reproductive endocrine activity that occurs in the female. The hypothalamus in the brain produces gonadotropin-releasing hormone, or GnRH, which acts on the pituitary gland. The pituitary gland lies below the hypothalamus at the base of the brain and is divided into anterior and posterior sections. Gonadotropins FSH and LH are produced in the anterior pituitary. FSH and LH act on the ovary, stimulating production of initially just estrogen, followed by progesterone when ovulatory cycles are established. Estrogen acts as both a negative and a positive feedback mechanism on the hypothalamus and pituitary. During fetal life and for several weeks after birth, endocrine activity is high. Shortly after birth, the pituitary and hypothalamus become very sensitive to the negative feedback of estrogen, which leads to suppression of reproductive endocrine activity. During childhood, the hypothalamic-pituitary-Ovarian axis is quiescent from suppression by low levels of ovarian estrogen. During puberty, this axis becomes active again from decreased suppression of the hypothalamus and pituitary, triggering the production of GnRH from the hypothalamus. GnRH again stimulates the release of gonadotropins FSH and LH from the pituitary, which have their effect on the ovaries. Estrogen is released from the ovary and causes the breast development and endometrial changes of puberty. So 3 important changes start to occur around 6 to 8 years of age that include, number 1, the decreasing suppression of the hypothalamus and pituitary from estrogen. Number 2, a resultant increased production of pulsatile GnRH from the hypothalamus and stimulation of gonadotropins from the pituitary. And number 3, the process of adrenarche. Adrenarche, also known as pubarche, is the increased production of androgens from the adrenal glands that leads to growth of pubic and axillary hair. Adrenarche precedes menarche by about 2 years. However, adrenarche is a separate process from the hypothalamic-pituitary-ovarian activities. The timing of puberty is mostly a function of genetics, with a good correlation of the timing of menarche between mothers and daughters and between sisters. Minor determinants include nutritional status, a child's general health, and geographic location. The role of total body fat in the timing of puberty is controversial. This graph shows the decline in the average age for menarche between the years 1840 and 1960. Although genetics is now the primary determining factor for the occurrence of menarche, the decrease in age of menarche during this time is attributed to environmental factors of improved childhood nutrition. This decreasing trend halted about 1960. Now the average age for menarche in the United States is 12.8 years. Menses are usually anovulatory for 12 to 18 months after menarche. This slide shows the expected normal sequence of events during the secondary sexual maturation that occurs during puberty. Breast development, referred to as thelarche, begins first, followed by adrenarche, peak growth rate, menarche, and finally ovulation. The sequence occurs over a time span of approximately 4.5 years. The sequence of expected breast development and pubic hair growth is described by Tanner's classification of sexual maturity. Tanner's staging of breast findings and median age is listed here. Tanner staging for pubic hair growth is listed here. Peak growth rate occurs about 2 years after breastbudding and 1 year prior to menarche. Most of a girl's growth in height has occurred by the onset of menarche. However, significant bone mineralization is occurring at this time. Half of total body calcium is laid down at puberty, so calcium supplementation is important during adolescence to maximize a girl's peak bone density and protect her against osteoporosis and fracture later in life. Thank you for your attention during this presentation on normal puberty.